Good afternoon, ladies and gentlemen. This is Jared J. Wallen, MD, board certified urologic surgeon and men's sexual health specialist, coming to you live from sunny Sarasota, Florida. You and we, urologic surgery and wellness. Today we're talking about the Rezum system. For those of you that don't know, enlarged prostate, BPH, lower urinary tract symptoms are very common in men as they get older. About 50% of men over the age of 40 may have some symptoms of enlarged prostate, BPH, or lower urinary tract symptoms. These are things like urgency, frequency, slow stream, getting up at night, potentially even having bladder stones, catheter, hematuria, or other things. And these can all be signs that the prostate essentially pinched the tube closed on the urinary channel. Ultimately, this leads to compression of the urinary channel and difficulty with emptying the bladder, difficulty with the stream of urine. How does the Rezum system work? As you can see here, there's a little needle that slides into the prostate. Basically, that needle is directed by me with a camera, and it delivers little steam treatments in 9-second intervals to the tissue. And that basically kills the tissue in a 1 centimeter area, about the inner 30% of the prostate. And that tissue then is reabsorbed through your body's normal processes, or essentially kind of sometimes sloughs off and is removed. That happens over a period of about 4 to 12 weeks after your procedure. And then the channel goes from small and tight to larger and much easier for the urine to flow through. Today, I have with me one of my patients, Richard Urban. He is a Rezum patient and has had treatments. It was approximately 4 or 5 months ago. Is that right, Mr. Urban?
Yes, sir. October.
Perfect. So 4 or 5 months ago, he had treatments, and he's here to talk to us today about his experience. So without further ado, Mr. Urban, can you please just talk to the audience about A, who you are, B, what was going on before the procedure, and what kind of symptoms you were experiencing?
Okay. My name is Richard Urban. I started experiencing the urinary problems, I want to say probably about 3 or 4 years ago. Mostly it was getting up at night, hard to urinate, hard to empty the bladder. And as time went on, it got progressively worse. Back in, I want to say about 3 years ago, we went to the family physician, and he just, every time I had a physical, he says, "You have an enlarged prostate, you have an enlarged prostate." But he never did tell me what was going to be the next step, as far as getting fixed. So I just let it pass. We moved from where we were located in Ocala, Florida, moved back down to the Tampa area. And soon after we moved, I started getting ill, and I survived the illness, but I had a persistent cough. My wife made me go to the walk-in clinic, the urgent care, where they assessed me and said I was in atrial fibrillation, which put me in the emergency room the next day.
Wow.
And I was in the hospital 3 weeks, had open heart surgery, discovered that I had 3 blocked arteries, bad mitral valve. And after the recovery, my heart was too weak to process fluids. In addition to my urinary problem, I couldn't eliminate fluids at all, so I was administered a catheter. And soon after that, the COVID became known, and I wasn't able to really see a urologist. He's pretty much booked up for months, so I was stuck with this external catheter with a bag strapped to my leg and hopeless. They said, "Just come back in 30 days, we'll change it out. Come back in 30 days, we'll change it out." And that got to be frustrating. So I decided to take things on my own, and just out of curiosity, I went on to both Google and YouTube and asked, is there any way to bypass this condition I'm in? Because of my condition, I had a weak heart. They couldn't put me under anesthesia, and they couldn't take me off my blood thinners. Right. So I said, I'm kind of stuck between a rock and a hard place. Is there something I can do about this? And that's when I discovered the Rezum. it looked like a very viable option because of the fact that they wouldn't have to put me under anesthesia. It was an outpatient procedure, and I very well could have stayed on my blood thinners, which at the time was pretty important to my cardiologist. So went on YouTube and discovered Dr. Wallen here. And I said, wow, he's very close to me, because everybody else was maybe 50 or 100 miles away. I'd have to travel. So when I found Dr. Wallen in Brandon, I went, that's the man. So I made an appointment and we had our consultation.
Perfect. And so you came to me with a catheter, right?
Yes, sir.
You were still in between procedures with your heart. I think you were supposed to have an ablation shortly thereafter, right?
Correct.
So what did we do for you initially that kind of changed things from the slavery with the catheter?
The immediate relief of getting rid of the catheter, because once you saw what I was dealing with, you said, we're going to get rid of that thing today. And explained to me the spanner internal catheter, which was, far and wide greater than carrying around that stupid tea bag strapped to my leg and everybody kind of looking at you if you go anywhere, because it's under your shorts pants and you can't wear long pants because you have to take them off to drain it. Right. And ultimately, in the middle of shopping or something like that, you're going to have to go to the bathroom and drop your drawers. So the spanner was awesome.
Right. So you can see here the little spanner stent. Basically, it's a replacement for a Foley catheter in patients who have a functional bladder. And certainly it's basically a temporary stent that allows men to pee through the prostate and holds the prostate channel open while they can still pee basically naturally, versus a typical Foley catheter, as you can see here, where basically it's a tube that's connected to a bag that basically sits in the bladder but drains into the bag. And, obviously that creates some logistical problems from a quality of life standpoint. And so the spanner catheter sits in the prostate and ultimately allows men to essentially have more freedom and not have to wear a bag and these types of things prior to procedures like Rezum or other BPH or enlarged prostate procedures. Perfect. So from that standpoint, so we switched you back to a Foley catheter for a little bit, then switched you back to the spanner and got you set up for the procedure, as soon as the cardiologist was happy with your previous procedures and your heart status. So let's talk about the procedure itself. What was your experience like with the Rezum treatments, and what can you share with our viewers?
Well, I will say that it's not painless. However, the anticipation of functioning without either the spanner or the Foley bag was far and wide worth it was awesome. Wore the spanner for about 3 or 4 more weeks to heal the procedure. And after that, I've been functioning fine.
Nice. So again, the procedure itself, usually we give you either oral sedation with a medication called Valium. We also do that typically with a combination of local anesthesia. The other alternative that's coming around nowadays is what's called nitrous oxide, which is basically the same laughing gas that you get at the dentist. Certainly can be an option for folks. Ultimately, again, as you can see here, the little needles directed into the prostate. We deliver up to 15 9-second treatments to the inside tissue. And so you can see a very short period of time, some treatments, but there is some minor stinging or burning, as Mr. Urban is talking about. We can't take away all the pain, but we certainly can try to make it as easy as possible on you. And then, ultimately afterwards, because of his situation was more advanced, basically he switched out to the little spanner catheter for about a couple more weeks afterwards. And then once we got him free of that. So how are things going now with your urination? What's your life
wonderful
like now?
It's wonderful. I do get up occasionally during the night, but not near as much. And I'm able to empty my bladder completely. It's not as I used to go with my wife shopping, and I'd say I have to go to the bathroom. She said again and again and again. And that's alleviated that completely. And I'm just ecstatic about it. And
Awesome.
being that the procedure itself was outpatient, I didn't have to get put under anesthesia. There was not a day and a half stay in the hospital where the traditional, I guess what they roto-rooter is what they called it. It's awesome. The whole experience was great because I was stuck with that catheter for 8 months.
And that's probably the most important part, is getting rid of those tubes, right?
Exactly. And above and beyond what you advised me that having that catheter, you'd get more likely an infection, a bladder infection, which I did experience 2 or 3 times before we got rid of it.
Right. Yeah. We know that there's very good data that shows that about 1% chance per day. So, if somebody has a catheter for up to 100 days, there's a darn good likelihood that they're going to have at least one infection, maybe even more. And so from that standpoint, things are going well now. Things are flowing well now. No more tubes. That's awesome. Great to hear. Anything else you want to tell the viewers that are watching?
I'm functioning the other portion of my urinary tract, I guess. I don't know.
Preserve your sexual function. That's what you're talking about?
Yes, sir.
Perfect.
Yes, sir. It works fine.
Awesome. That's great news as well, right? Because obviously the primum non nocere is the adage in medicine, first do no harm, right? And so we always want to treat you and get the best result possible, but not affect anything else. And certainly that's one of the reasons that the Rezum system, other than the fact that it can be done in the office, the fact that it can be done like yourself, you were still on blood thinners, and the fact that it has a less potential of side effects on sexual functions, that's certainly super advantageous to all patients.
Yes, sir.
I always talk to my patients regarding that beforehand, because there's always, random events that can occur that some people do have some, different side effects along the way across the continuum, not just from a sexual function standpoint, but the reality is there's basically 4 main sexual functions that we consider. 1 is the erection, 2 is the sensation, 3 is the orgasm, and 4 is the ejaculation fluid. And unless you're really trying to have kids, the ejaculation fluid is probably the one that I would consider most acceptable to sacrifice. And so if you maintain the other 3, you get good erections, you have sensation, you have orgasm, but you just don't have fluid coming out. In the risk benefit scale, I think that's acceptable for most patients. The reality is the problem, part of the reason that there can be some fluid changes is that, number one, when we increase the size of that channel, remember that channel is short and it goes back to the bladder very easily, versus the long channel through the penis the rest of the way out. And so sometimes you can get what's called retrograde ejaculation. Commonly men have this even if they're taking Flomax, which is a medication that's common for BPH and large prostate. About 75% of men have it just on medications. The other thing that can happen is that, remember, when we essentially kind of kill off prostate tissue, approximately 80 to 90% of your fluid is actually from the prostate and seminal vesicles. And so that can be the other part of the reason that sometimes there can be some alteration in the fluids. Anything else, Mr. Urban, that you'd like to share with our viewers?
Well, I'd like to say that I haven't had many experiences with urologists. The first one basically was after my heart surgery, and I never saw the urologist himself. I saw his either nurses or nurse practitioners who did nothing, had no knowledge of the Rezum. After talking to you, I've gained so much knowledge about what was going on. You were very, very patient-oriented. I really appreciate all the information and all the care you took. And visiting the urologist afterwards to have the spanner removed at the location we were at, and that urologist had no clue about what that piece of equipment was. The nurse who worked with you had to tell him, take it out. So this is, I don't know how new it is, but it's not well spread as far as the knowledge is concerned. So anything you can do to spread it, it'd be wonderful for everybody out there.
Absolutely, sir. Well, the beauty of it is you're doing a lot of the spreading right now, because patients always love to listen to other patients talk about their experience with procedures and what they're like. And rather than coming from me, a surgeon, ultimately the beauty of a patient being able to share with other patients is awesome. So thank you so much for being with us today. Again, this is Jared J. Wallen, MD, coming to you live from sunny Sarasota, Florida. You and we, Urologic Surgery and Wellness. This was us talking about the Rezum system with Mr. Richard Urban. You can see below, go ahead and like the video, share it, or subscribe to our channel if you're enjoying our content. We'd be happy for you to help us spread the word and spread the knowledge so we can help other patients.